Thank you, Chair. The meeting is now live.
Thank you very much, Kirsty. Thank you. And welcome, everybody, to this meeting of the Local Outbreak Engagement Board for Bracknell Forest. The first item on the agenda is apologies for absence. Could I ask if we have any, please, Kirsty?
Chair, I've received apologies from Fiona Slevin-Brown, Andrew Hunter and Tessa Linfield. As is sometimes the case, people can have problems accessing the digital meeting, so anyone who doesn't appear in the call will have their apologies recorded.
Thank you very much indeed. Thank you, Kirsty. Members of the board, would you please now turn on your microphones and confirm that you're present when Kirsty calls your name? And as Kirsty has just said, anyone who doesn't respond will be recorded as having given their apologies. Thank you.
Thank you. Councillor Dr. Barnard.
Present.
Councillor Betterson.
Present.
Councillor Birch.
Present.
Councillor Brunel Walker.
Present.
Andrew Hunter's provided apologies. Abby Thomas. Kelly Williams.
Present.
Charlotte Pavitt.
Present.
Elena Rozelle.
Present.
Acting Inspector Sophie Gardner.
Present.
Fiona Slevin-Brown has provided apologies. I am expecting Rachel Wakefield. Rachel, are you present? Philip Bell. Other attendees with standing invites, Tim Whedon. I believe we have a substitute. Kevin Gibbs.
Kevin Gibbs is substituting for Tim Whedon, Executive Director Delivery.
Thank you, Kevin. Tessa Linfield has provided apologies. Sabrina Quah. Councillor Mrs Hayes.
Present.
Councillor Harrison. Councillor Hayden. Councillor Turrell. James Sunderland MP. Adam Afriya MP. Jerry Barber. Mary Stamp. Is there anyone else present whose name I have not called? Thank you, Chair.
Thank you very much, Kirsty. Thank you. And we can move on now to agenda item number 2, which is declarations of interest. The full text for declarations of interest is set out on the agenda at item 2. If any member has a disclosable pecuniary interest or an affected interest to declare, please indicate in the meeting's chat and I'll come to you in turn. I can see no indications. So the usual, there are no interests indicated, but at the appropriate point, should any individual discover that there is an interest, then please feel free to interrupt proceedings to register it at that time. So with that, we move on to agenda item 3, and which is urgent items of business. Do we have any urgent items that we're aware of, Kirsty?
No, Chair, I'm not aware of any.
No, okay, fine. In which case we'll move on to item 4, which is to review the current data that relates to the levels of COVID-19 infection rates nationally and within the borough. Over to you, please, Charlotte.
Thank you, Chair. Just bear with me while I share my screen. Is everybody able to see the presentation?
Yep.
Okay, lovely. So just to reiterate that this information is up to date as of the 31st of March when the report was produced. So across Bracknell Forest to date, we've had 6,000, just shy of 7,000 confirmed cases across the entire pandemic. And when we look at the weekly case rate per 100,000 population, which is noted here on the top row and the central column, we're now right the way down to 35.1 cases per 100,000 population. That's a 19% drop from the previous week and a 2% drop from the week before that. So what you can draw from that is that we've seen a significant reduction since the new year in cases, but over the last few weeks, the case rate has now started to level off, and we're consistently seeing a case rate around about late 20s to mid 30s per 100,000 population. The good news story is in our over 60 population. This is our most vulnerable population and those most at risk of severe illness, hospitalisation and unfortunately mortality as well. And that's gone right the way down to only just over 8 cases per 100,000 of the over 60 population. In terms of our testing, the individuals tested per 100,000. Now I should stress that this is our PCR testing within the community and within hospitals. So this is symptomatic testing and certain healthcare worker testing. We've got a rate of 323 individuals per 100,000 being tested, which is a slight reduction on the previous week, which we would expect to a certain degree, given that the rate of transmission is reduced and therefore the level of symptoms is reduced across the borough. The numbers who are testing positive have also reduced, so only 1% of all those tested were positive, again indicating a reduction in the level of transmission across the patch. And as you can see, only 43 cases were seen in the last 7 days. So a good news story in terms of the reduction, but the levelling off, and now with the easing of the roadmap and more and more people out and about, we do need to continue to be vigilant, to continue to follow the hand space and face rules to ensure that we don't start seeing an upturn of the rates locally. We are also going to report today on vaccinations, and we've changed the presentation somewhat so that it's meaningful data that we're presenting to the board. Because the numbers are so low, it's not appropriate to now compare across wards, etc., because the numbers are too small to be meaningful. Therefore, we've pulled out the real highlights for you today. And the highlights being the numbers vaccinated across the patch. So we can see here in this bottom table the estimated population coverage in Bracknell Forest by age group, and we know that the vaccine rollout has been done sequentially by age. So those age groups that we started with, the over 80s, then moving down the age range, you can see in Bracknell Forest we've got extremely high coverage, over 90% of our 65 and overs, and even 60 to 64 and 55 to 59, which we've only recently been inviting to come forward for vaccination. It's extremely positive at nearly 75% in that lower age group and 85% in the 60 to 64. Under 64, it's 17%. That would be individuals who are considered clinically extremely vulnerable and have conditions that require vaccination. It's comparable to the England So again, a good news story there. We're now beginning to do some additional work to ensure that the uptake of vaccination is equitable across all of our population groups, and that there are no population groups where uptake is lower, and where that is the case, trying to understand what those barriers might be and encouraging those communities to come forward to get vaccination. We've pulled out the number of cases by age, because there's, as you can see, the good news story in the older age groups up at the top of this graph here in Bracknell Forest. It's gone extremely pale, and we know that our weekly case rate per 100,000 is dropping. So again, a good news story for the vaccination. These are the groups that we are vaccinating, and these are the groups that are most at risk of severe illness. We've got a darker shade here, the time being along the bottom. So in recent weeks, in 15 to 19-year-olds, and that will be a result of the schools reopening and also us testing secondary school age children. So it will be a combination of some increased transmission because individuals are mixing within the school setting, but we're also seeking to find more cases with the asymptomatic testing that's going on in schools. So we would expect that number to be, the graph to be darker, indicating a higher rate in that age group. What we do now need to make sure is that there's not additional transmission to other age groups, and if so, understanding where that's occurring, whether that's within households or mixing out in the community and not adhering to the restrictions. So in summary, the government has published the COVID-19 response, the roadmap out of lockdown, and I'll come on to the detail of that in a later agenda item. Currently, it enables people to meet outdoors in a group of 6 or from 2 households, but no indoor mixing. And again, we must continue to be vigilant and to follow the rules as we slowly emerge out through the roadmap and out of lockdown, to ensure that our cases that we're seeing continue to remain on that downward trajectory, and we don't start to have increased number of cases. When we compare ourselves to our neighbouring boroughs, there are now 4 local authorities, including Bracknell, with cases below 50 per 100,000, which is a good news story. The daily hospital admissions, which we haven't presented in detail here, but they continue to decrease across Frimley and the Royal Berkshire NHS Foundation Trust. So in terms of one of the tests that the government have and the number of cases and the pressure that puts on the NHS locally, that's a good news story as well. There have been, unfortunately, 11 COVID-related deaths across Berkshire over the last week, only 1 in Bracknell Forest. And in terms of our testing, and again, we'll talk a little bit about testing at a later agenda item, but the testing and the vaccination picture is positive, with increased rates across both vaccination and testing. And I will leave it there.
Thank you very much indeed. Thank you. That's great, Charlotte. And does anybody have any questions for Charlotte at this moment? No? Okay, fine. Well, thank you, Charlotte. And we'll move on then to agenda item 5, which is the roadmap out of lockdown and local response here in Bracknell Forest. And Charlotte, are you going to kick off again with that?
Please, yeah.
Thank you.
Bear with me. Should have put it all onto one presentation. Okay. Are individuals able to see?
Yep.
Okay, lovely. So I just wanted to summarise for the board the update on the local outbreak management plan for Bratton Forest and what that means in terms of the local response, but also set with the wider context of the announcements made around the roadmap yesterday. So we want to continue to keep our residents as safe as we can as we move through the roadmap out of lockdown and towards recovery. I updated the board at the last meeting that we had updated our local outbreak management plan, and that had been submitted to the Department of Health and Public Health England, and have since in that last 2 weeks have approved our plan moving forward. So it was just to draw attention that the updated summary of the plan will be published within the next week on the Bratton Forest website, the coronavirus information and support pages. And just to recap, that the plan will continue, it will have a number of key themes that we work towards, and it will continue to focus on preventing and managing outbreaks in our high-risk settings, such as workplaces, care homes, prisons, hospitality, hospitals, and education settings. But we will have a continued focus on particularly the vulnerable and underserved communities, and where inequalities start to emerge, we'll be able to identify them and target our response accordingly so that we're not further driving any inequality. The plan also has continued focus on compliance and enforcement, working in partnership with our community safety colleagues and Thames Valley Police to ensure, as we move through the roadmap, that individuals have the correct information and are adhering to the restrictions that are imposed at each stage of the roadmap. Governance and resourcing is obviously key, and we are currently working through how we are implementing the plan moving forward and have the adequate capacity to resource that accordingly. Communication and engagement continues to be central to the plan, not only effectively communicating the messages out to the general public, but also that two-way conversation and engaging them so that we understand what the barriers may be to some of the approaches that we're delivering, such as testing, vaccination, so self-isolation, etc. And also enabling and empowering local communities to build resilience as we emerge through the recovery of COVID. Data interrogation, information sharing and surveillance will be particularly important moving forward. We're going to move away from the broad brush approach at looking at what the epidemiology is saying to more deep dives into the data so that we can understand where enduring transmission is occurring and where our concerning trends may be emerging, so we can act in advance of outbreaks and clusters that from worsening. Local testing capacity. Again, I've got some specific slides. There was an announcement yesterday around mass testing. We need to continue to offer the symptomatic testing as has been throughout the entire pandemic, but the asymptomatic testing at scale is really coming to the fore now, and I'll be talking about that in the next couple of slides. Coupled with testing and identifying cases is then the contact tracing and advancing that to enhance contact tracing. So we're really focusing in on where individuals have been, where they may have contracted the virus, and identifying high-risk settings that we can work with and ensure that onward transmission doesn't happen again. But most importantly is the support for self-isolation and when we were shielding, unless individuals are supported and motivated and enabled to self-isolate when they do test positive, then the testing and the local contact tracing essentially is meaningless, because it's the self-isolation that stops the transmission and reduces the rates further. So we really need to ensure that our self-isolation offer supports everybody in the borough to do so. Outbreak management hopefully will reduce down, but is still an important element of the plan, and we still need to have those responses in place as and when outbreaks and clusters occur. And then the plan will continue to develop what living with COVID looks like. That includes the interface with the vaccine, and now, as mentioned in the announcement yesterday, the upscaling of testing moving forward. So I just wanted to summarise for the board what the sorry, excuse me, I've got the Zoom meeting in the wrong place. What the plan looks like from the 12th of April as announced yesterday. So we know that there's no change to the education provision. Social contact remains the same for the time being, or 2 households outdoors only. Only household mixing indoors, and again stressing the importance of hand space and space when you do meet up with those outdoors. So if you're enjoying outside space in a pub or restaurant, garden, then it's important that social distancing remains to reduce the risk of transmission. It will obviously have 12th of April has a big impact on our local infrastructure and economy. All retail and personal care will begin to open, and we're supporting our partners in doing so safely and COVID securely. We've got the COVID marshals, for example, in the town centres to facilitate that. The opening of community centres and other local provision, libraries, etc., also comes into play. Again, we're having constant conversations with our local community centres, especially those that are hosting the local community testing, as to how we look to run that in a sustainable fashion. And most outdoor attractions, so zoos, etc., and theme parks and outdoor spaces that have been closed in the past will be able to open on the 12th of April. In terms of indoor leisure, that indoor exercise will be permitted for individuals in single households, where they can do so socially distanced from others, from other households or other bubbles. In terms of self-contained accommodation, again, that's permitted to open up, where they can ensure that single households are only staying in the self-contained accommodation. So, for example, where there's shared facilities, shared bathrooms, then it won't be permitted to open. And it should, moving on to the travel, really travel should be reduced to the minimum where possible, to again just to ease out of the roadmap slowly. Children activities and certain parent-child groups and wider groups are permitted up to a maximum of 15 people. So again, we're exploring the implications of that for the local authority. And as I've mentioned, outdoor hospitality is permitted where table service for individuals. Again, the rule of 6 or 2 households will apply in that setting also. As I've said, domestic overnight stays for households only are permitted, but it is encouraged that travel is kept to a minimum. And again, no decision yet on international holidaying. We're expecting further information on that in the coming weeks. In terms of events, Funerals are permitted up to 30 people, and weddings, wakes and receptions up to 15 people. But again, social distancing rules apply, and a number of event pilots are also being rolled out. So I just wanted to come on to the announcement around testing. We have had community testing within the borough up until this date, but the national announcement yesterday that anybody this one should read, anybody should be able to access testing now, regardless of whether you're leaving for work, volunteering purpose, exercise, meeting up socially. Everybody should now be encouraged to test twice a week. Now that can be, you can access tests via your employer if they are offering that. We've also got a number of community test centres which you can either get tested at, or you can collect tests from the same sites and take those tests home for home testing. There's a national programme around Pharmacy Collect, where again individuals will be able to visit local pharmacies to collect a supply of tests to take home and test. And we're currently working with pharmacies to identify which of our local pharmacies in Bracknell Forest are signed up to that scheme, and we will add that to our testing website as and when that information comes in. And as of the end of the week, individuals will also be able to order a home test kit from gov.uk website as well for home testing. And this will sit alongside the existing school testing, where individuals who either work or secondary school children will be provided their test kits from their school or college. And just to state, for asymptomatic testing, this is testing where there's no symptoms. Individuals of nursery or primary school age aren't required to test. Again, to stress that this is for individuals with no symptoms, because we know that 1 in 3 individuals will be carrying the virus without any symptoms at all. If you do experience symptoms, you should be booking a test via 119 or the gov.uk website, and that will be one of the PCR tests rather than the rapid 30-minute turnaround lateral flow tests. And the second point to stress and to raise is that those individuals who have already been vaccinated. Vaccination, whilst it has an important part in returning to normal and to protecting us from the virus, it doesn't, the evidence is still emerging around it stopping transmission. So it protects you from severe illness. However, it doesn't fully protect you from onward transmission. So it's still important that individuals engage in the testing programme, as well as hands, face, space, etc., even when they've had their vaccine. And I just wanted to highlight here, we've got 6 community testing sites. They're open across the 6 days of the week across a variety of opening hours, and that coupled with the fact that individuals can collect tests to do testing at home should really increase accessibility of testing. And obviously the important message is, if you do then positively test, you must self-isolate for 10 days. That's the action that's going to stop the onward transmission. But all information's on our rapid testing website that I referenced on the previous slide.
Thank you very much indeed. Thank you, Charlotte. Colleagues, does anybody have any question on that? Dorothy, your hand's up.
Yeah, it may sound huge, Charlotte. You've given all the great answers I want for where they are, how we go about it, but there's going to be one question that looms around my area. Does it tell them on it how they dispose of it, whether it's recycled? I know it's a silly question, but it's one that could be asked, and we should be able to cover ourselves on that as well.
Yes.
Is it recyclable, or is it in black, brown, our green waste?
No, so it's considered domestic waste, but it will go into.
It's just having that answer ready, because there will be those that will ask us.
Yeah, that's a very good point, and I'll make sure that information is put onto the rapid test website, and we can look as to what the information is given out with the testing to advise accordingly. So thanks for raising that. That's really
yes, because it will be landfill waste then. Okay.
Thank you very much. Thanks, Charlotte. Any other questions? Nobody's indicating. So fine, then thank you very much indeed, Charlotte. That was a great help. We move on to agenda item 6, which is communications and engagement at national and local level. And if Abby is not here to do that, then I'm presuming that it's Elena.
Yes, thank you, Chair. Just bear with me for 2 seconds while I share my screen.
Thank you, Elena. We have it.
Excellent. Just trying to make it a bit. So I'm just going to give you a very brief rundown of what we've been working on the past couple of weeks and what we'll continue to be working on over the next couple of weeks. Unsurprisingly, you'll notice that our priorities have been around testing, continuing to promote how and why people should get tested. As Charlotte alluded to, it's really important that people continue to get regular asymptomatic testing. And with the announcement yesterday that everybody should be getting tested twice a week, we're going to start pushing that a bit more widely. And we're also promoting new testing sites, specifically the one in the town centre, just so that everyone knows where they can go and get tested, and trying to increase that accessibility as much as possible. Vaccinations, we've continued to encourage vaccine take-up where we can, as well as myth bust anything that we know is causing some hesitancy. So as Charlotte mentioned, we've had a couple of question and answer sessions with medics and with local community groups and with our own staff, just to understand what the barriers are and how we can try and solve that and give people the reassurance that they need, and certainly the information they need to make an informed decision. We've started to link the testing and vaccination messages more widely in our communications alongside the hands, face, space, so that people understand they need to keep doing this to protect themselves and protect their loved ones. We're also increasing the key messages that people who have been vaccinated still must follow all the rules in order to reduce the risk of onward transmission. That is really important and really key, just that we don't start seeing the transmission increase. In terms of the roadmap, we've been promoting messages about the changes that happened on the 29th of March, specifically around meeting up outdoors and making sure that you don't meet up with any more than 2 households, or the rule of 6. And we're planning communications around step 2, which will go out later this week in preparation for the changes on the 12th of April. Specifically, we're focusing on the reopening of non-essential businesses, leisure centres and outdoor hospitality, so people know the rules and know how to do things safely. In conjunction with this, we've produced some supported information on keeping safe over Easter, Passover and Ramadan, because they're quite key events in the calendar whereby people naturally will group together and the risk of transmission is greater. So we've been pushing those messages too. And also the hands, face, space, ventilate and isolate messages are being weaved into these communications. They really are still key. In terms of self-isolation, I think Abby mentioned last time that we've started to look at increasing where we can promote what self-isolation means and why it's important. This work's starting to ramp up. We've done several communications on this, both over the past couple of weeks. And what we're looking at now is actually widening that message and looking at which marketing opportunity we can use to maximise that coverage, whether it's radio, whether it's paid for social media advertising, just so that we're hitting all of the audiences that we can, because it's a really important key message. And then the final place where we've been spending quite a lot of time over the past couple of weeks is promoting what's happening around shielding. which paused on the 31st of March, and just making sure that our clinically extremely vulnerable residents have access to information that they need to get them back out into society. And if they need any support or advice, that they know exactly where to go for that. More than 2,700 hard copy booklets were sent out, plus around another 3,000 e-newsletters. And that we've also made content available on our website and other digital channels as well. That's a real whistle-stop tour through comms, but happy to take any questions.
Thank you very much, Elena. Thank you. Are there any questions? No, not seeing anything. Nobody's waving frantically. Well, thank you very much indeed then, Elena. Thank you for that. And next we move on to agenda item 7, which is public participation. Kirstine, do we have any questions from members of the public?
Chair, I'm not aware of any questions that have been submitted to the committee Dropbox in advance of the meeting.
Okay, thank you very much. Thank you. In which case we move on to agenda item 8, which is to review the action log. That's to review by exception the ongoing action log for the local outbreak engagement board. Does any member have anything to report on that? Just reminders of open items. We've asked that all board members would notify the board of any false or fake news so that it can be addressed and countered with accurate information. If anybody has any fake news, please don't forget to submit it so that we can deal with it. Also, all board members have been asked to provide Elena with, or any member of the communications team with contact details of anyone who would be willing to share their COVID-19 story as a case study about how COVID-19 has affected them. And Charlotte is keeping an eye open for clarification on the South African variant and any impact that it might have on Bracknell Forest. Still, I'm seeing no comments at the moment from anyone, but please don't forget those open items. And that then draws today's meeting to a close, and I'd like to thank all board members for participating in this virtual meeting. The next scheduled date for the board to meet is Tuesday, the 27th of April at 4 p.m. And I now declare the meeting closed, and I'd ask Democratic Services please to confirm when the meeting has stopped being broadcast. Thanks very much.